Let's start looking at conditions of the cardiovascular system. But before we go any further, let us try and look at we do a brief review of the cardiovascular system. Now, the cardiovascular system is part of the two systems in the circulatory system. When we were doing anatomy, we learned that the circulatory system includes the cardiovascular system and the lymphatic system. And the cardiovascular system or the blood circulatory system is the one that has blood, is the one that has the heart, and is the one that is responsible for circulating oxygen to all body parts. And we said that the cardiovascular system is made up of the heart, which has four chambers, the two atria and the two ventricles. We have the left and right ventricle and the left and right atria. And we say that on the left, we have the left ventricle, which is responsible for pumping blood, which is oxygenated to all body parts from the lungs. And then on the right, we have the ventricle, which is responsible for for pumping deoxygenated blood to the lungs. And so we also say that the cardiovascular system is also made up of blood vessels. It is made up of three general types of blood vessels, which include the arteries, which are responsible for carrying oxygenated blood, veins, which are responsible for carrying deoxygenated blood, and we have capillaries. Okay, so we said that the only a blood vessel, the only artery that carries blood, the only artery that carries deoxygenated blood is the pulmonary artery, because this one takes blood from the heart to the lungs, that blood which is deoxygenated. Okay, the only vein which carries oxygenated blood is the pulmonary vein. So that is what we learned. We also learned that blood is made up of a liquid part and formed substances, dissolved substances. And they said that the liquid part is plasma, which has several things circulating in it or dissolved in it. Some of those things include proteins, which are responsible for several things, including clotting, okay, including things like maintenance of the fluid balance. Which amount of fluid is supposed to be in the blood vessels and which amount of fluid is supposed to be in the interstitial spaces. And we also learned that the formed substances of blood includes blood cells, which are three. There is the red blood cells, which are erythrocytes, the white blood cells, which are leukocytes, okay, and then we have the platelets, which are thrombocytes. So when we start looking at conditions of the cardiovascular system, we are going to look at conditions that affect the blood, first of all, and then we're going to look at conditions that affect the heart. When we look at conditions that affect the blood, we are going to look at conditions that affect the red blood cells, conditions that affect the white blood cells, conditions that affect the platelets. Okay, once we look at that, we'll go ahead and look at conditions that affect the heart itself, the functioning of the heart. So that is the brief review of the cardiovascular system. So now let us start looking at blood disorders. Blood disorders like I said earlier, can be can be separated into different types, and when we have those affecting red blood cells, those are known as anemias.
If God is your number
Those
one
affecting
priority,
the
always
white
be
blood
close
cells,
to
those
Him.
are called
Never.
leukemias. Those affecting the platelets, we have thrombocytopenia. Okay. We also have hemorrhagic disorders. Now, what is anemia? Anemia is a condition in which there is a reduction in the oxygen carrying capacity of the blood as a result of fewer circulating erythrocytes. Now, we should know at this point that erythrocytes are the ones responsible for hemoglobin, attaching hemoglobin such that once this oxygen attaches, for attaching oxygen, okay, every red blood cell has a component in it known as hemoglobin. Hemoglobin is the one responsible for attaching oxygen. Once oxygen is attached to it, these red blood cells with hemoglobin that has oxygen attached to them are then circulated to all body parts. Okay. Now, once there is a reduction in either these red blood cells or the hemoglobin in the red blood cells, we are going to call this anemia. Okay. And this anemia can be caused by different factors, and these include issues like hemolysis. Hemolysis is simply the breakdown of normal red blood cells or red blood cells, whether they are sick or not. Okay, hemolysis is the breakdown of red blood cells. Okay, anemia can be caused by other factors such as hemorrhage. Okay, well, this is simply bleeding, severe bleeding, such that person ends up not having enough red blood cells. Now, the characteristics of anemia include tachycardia, headache, and malaise. Now, always remember when you're writing a definition, you have to include things like the system, okay, or whatever part that is involved in that particular condition, okay? So in this case, we're saying that anemia is a blood disorder. Okay, that is what is involved. And then the other thing you should include in your definition should be what exactly is happening in this condition. So in this case, we're saying there is reduction in the oxygen carrying capacity of the blood. Okay. And then the other thing that you should include in your definition should always be the cause. What is it that is causing this particular condition, that is causing this particular situation? And in this case, for anemia, we have said that we have several different factors that cause anemia, and one of those is hemolysis, and the other is hemorrhage. And the other thing that you should include in your definition should be characteristics, meaning signs and symptoms. You have to mention at least two signs and symptoms or characteristics of the condition that you're talking about. So in this case, we have said that this anemia is characterized by tachycardia, headache, and malaise. So all the time, make sure these things come out, okay, in your definitions. Very, very important. Now, we're saying that anemia is like a fever or like a headache. If one if one has a headache or a fever, you should endeavor to find out what is causing that fever. It is like a symptom, okay? It's like a sign that there's something wrong. So when someone comes to your healthcare facility and you realize that they have anemia, you have to start looking into why do they have anemia? Is there an underlying condition that is causing this anemia? Okay? Now we have several types of anemias. And we're going to talk about four very important types of anemias, and you have to know all of them by heart. The first type of anemia is hemorrhagic anemia. Hemorrhagic anemia is one that is as a result of bleeding, as a result of loss of red blood cells. Now, red blood cells are supposed to be, all the blood cells are supposed to be within a particular range. number. Okay, they're supposed to be within a particular number, and red blood cells are supposed to mature to a certain stage where they should die. Now, the life cycle of red blood cells is supposed to be 120 days. 120 days. However, when there is a lot of bleeding, okay, when there is a lot of bleeding, now, before we go into the bleeding, when the red blood cells, when the red blood cells reach their maturity level, which is 120 days, they are broken down. Once they are broken down, the byproducts of these red blood cells, in particular iron, okay, is reused to make some more red blood cells. The body reuses some of the byproducts, in particular things like iron, okay, are reused in order to make new red blood cells. However, when someone bleeds or has been bleeding chronically, whether it's a chronic kind of bleeding or it's an acute kind of bleeding, when you say acute, we're talking about something that has happened within just a few hours or within just a few days if it's a disease. But when someone bleeds profusely, they have lost those red blood cells that are supposed to be broken down by the body, and the body reusing the byproducts. And therefore, this person will end up with anemia. Okay? That is hemorrhagic anemia. And then we have hemolytic anemia. Hemolytic anemia, that is the second type of anemia. And this anemia is due to the severe destruction, okay, of red blood cells. There are some conditions that cause breakdown of red blood cells at a higher rate and before they mature to reach the 120 days that they're supposed to live. And therefore, once they start breaking like this, you find that the body is overwhelmed with byproducts of red blood cell breakdown, okay? And then you find that most of these red blood cells that are being broken down are not even mature enough to die. They haven't reached the 120 days. And therefore, you find that the body will try to form as many red blood cells as possible, but it cannot. And also, this person will still end up with anemia because there is increased breakdown of red blood cells. Now, some of the conditions that may cause this hemolysis would be conditions like sickle cell disease. Sickle cell disease, where there is breakdown of these red blood cells at a very fast rate. Conditions like malaria, okay? These also cause destruction of red blood cells. Issues like incompatibility when there has been blood transfusion with the wrong blood group. Okay, so you find that that incompatibility of blood will result in breakdown of the red blood cells, and therefore this patient will end up with more severe anemia. Now, each of these types of anemias have different types or different signs and symptoms. So you have to know them. So some of the symptoms for the hemolytic anemia include hemoglobinuria. This is where you're going to find hemoglobin. Remember, we said that red blood cells have this component in them that is known as hemoglobin. And so once there is breakdown of red blood cells, you'll find that those byproducts will start circulating in the blood. Others will start going out through urine, okay? So you find that this patient will have hemoglobinuria. When you hear a word ending with nuria, then you're just talking about urine. So you're going to find that once you do a urinalysis, the patient is going to present with hemoglobin in urine. The other sign will be the patient will have ulcerations of the legs, okay? Usually when there is hemolysis of red blood cells, you're going to find destruction of other blood cells as well, particularly the platelets, and therefore this patient will have easy bruising. The patient will have pruritic skin. Pruritus is simply itching. The patient will start experiencing itchiness. They're just sitting nicely. Suddenly the skin is just itching. That is due to the settling of these red blood cell breakdown byproducts under the skin, and therefore the patient will experience a lot of itching. Patient will experience what is known as splenomegaly. Splenomegaly is simply the enlargement of the spleen. The enlargement of the spleen. Now, the spleen is the organ that is primarily responsible for breakdown of the old red blood cells. Okay? Once there is breakdown of even the red blood cells that are not old, it means the spleen will be overused. It will be overworking. Once that happens, it will start swelling, okay? It will start becoming bigger. It will become enlarged, and therefore we are calling that splenomegaly. Other things that will be happening will be skeletal changes. Remember, we are saying that the bone marrow is going to try as hard as possible to form more and more red blood cells. Okay, and in that way, you find that even the bone marrow is being overused. And so you find that this patient is going to have enlargement of spaces where there is marrow, especially where there is red bone marrow. And so you find that the patient's bones on the joint areas will look like they are larger than they should be for a particular sized person. The patient will experience mild jaundice. Jaundice is simply the yellowing of the mucus, the skin, okay, the mucous membranes and the skin. So you find that you look at this patient's mouth, the mucous membranes in the mouth, they are yellow. Or you look at the sclera of the eyes and they look yellow. That is jaundice. Now, that is a result of uh, excessive amounts of bilirubin. Bilirubin is also a byproduct of red blood cell breakdown. Now, bilirubin is supposed to be conjugated by the liver, okay? Once there is too much bilirubin, it means that there is going to be an overwhelming amount of bilirubin in the body. And so the liver is going to be unable to conjugate it. Conjugation simply means addition of some sugar molecules and making this bilirubin soluble enough, okay, to be excreted, okay, from the body. But when there is too much, the liver is overwhelmed, and so there's going to be a lot of unconjugated bilirubin in the bloodstream, which is going to start settling under the skin and the mucous membrane. And even if it's not settling, you will notice that the patient will start appearing yellow on the skin and the mucous membrane. The patient may also develop gallstones, okay? Gallstones are simply stones in the gallbladder. Okay, there's going to be excessive bilirubin, which is going to start forming stones. Okay, and then the third type of anemia is known as blood forming element deficiency anemia. We have several elements that are responsible for the formation of blood, and some of these elements include iron, vitamin B12, folic acid. So a human being may have deficiency in either one or all of these blood-forming elements. When there is a deficiency in any of these blood-forming elements, you find that the patient is then said to have a blood-forming elements deficiency anemia. This could be due to several factors. Factors that include things like a pregnancy where there is high demand of where there's a high demand of blood. Okay, so you find that if the person is not even eating enough, they will have deficient blood forming elements, and therefore they will have anemia. They'll end up having anemia, chronic blood loss, okay, from the GIT, for example, when the patient um, has been having worms. Now we have several worms that suck blood, okay? Even if they're not sucking blood, there are other types of worms that will just simply eat the food that the person is eating. And that food, once a person eats, that is the food that the body gets to extract the blood-forming elements. However, when the worms are eating this food, it means the person will end up having this blood forming elements deficiency anemia. And then we have things still of the GIT, such as ulceration. So if the patient has had ulcers and they keep bleeding chronically from the GIT, you find that they still end up having blood forming elements deficiency anemia, because they don't have those elements that that should be reused to form blood. Carcinoma, okay, of the GIT will also cause blood forming elements deficiency anemia due to many different factors, e.g., the inability of the GIT to absorb, okay, to absorb the inability of the GIT to absorb the food that is being eaten in order for the body to extract the elements that are needed for formation of blood. Okay, we have other factors such as someone who has had gastrectomy. Gastrectomy is simply the removal of part of the stomach. Once that happens, there is destruction of the cells. There are some cells in the stomach that are responsible for producing a certain factor which is known as intrinsic factor. Intrinsic factor has a sole function of going to the small intestines and mediating the absorption of vitamin B12. Once these cells have been destroyed, maybe due to surgery or carcinoma or anything, it means that the patient or that person is not going to have cells, or the cells will be reduced in number that produce intrinsic factor, which means this human being will be unable to absorb vitamin B12, and therefore this human being will be having blood forming elements deficiency anemia. Okay, so those are some of the causes of blood forming elements deficiency anemia. Some of the clinical manifestations of blood forming elements deficiency anemia include a patient will present with inflammation of the mouth. Okay, the tongue will look inflamed. Okay, those are the people that when you look at them, yes, they're anemic, but they have sores in the mouth. Okay, fingernails will become brittle. They'll easily break. All right. They'll easily break. They'll look clubbed, like a spoon. You look at their fingernails, they look like a spoon. They are clubbed. Okay, patients will have dysphagia. Dysphagia is simply painful swallowing. This is as a result of atrophy of the esophagus. Okay, the patient will start experiencing pica. Pica is simply craving of weird foods. They'll start craving foods such as charcoal, such as earth, soil, okay? So this is because they will be lacking things like iron. So you find that they'll be craving all these um, uh, kinds of foods that are abnormal, okay? And then we have other signs and symptoms that are caused when there is insufficient vitamin B12, okay? Like we've explained, when there's deficiency in intrinsic factors, means those cells that are supposed to produce those cells that are supposed to produce intrinsic factor are destroyed, and so there's not going to be enough vitamin B12. Okay. And so you find that the patient is going to start experiencing angular stomatitis. Stomatitis is inflammation of the mouth. So you find that the patient is going to have inflammation of the corners of the mouth. Okay. And the patient will have lack of appetite, muscle weakness, impaired vision. Okay. Patient will experience pale yellow, they'll look slightly yellow, okay? This is as a result of a hemolysis, okay? Infertility in females. Others um, may have dementia as well. And then the other type of anemia, the fourth type of anemia is aplastic anemia. Aplastic anemia is when there is defective bone marrow function. When the bone marrow is not functioning according to the way it's supposed to function, it means it's not producing the blood cells the way it should produce the blood cells, okay? And therefore, this is known as aplastic anemia. There is suppression of the bone marrow. Now, this suppression of the bone marrow can be caused by several different factors. Other people, it can be congenital. Other people, it could be unknown, idiopathic, okay? For others, it could be when they are taking several substances. For example, drugs. We have several drugs that suppress the bone marrow function. And these drugs include things like chloramphenicol. And so they say one of the side effects of chloramphenicol is the reduction in immunity. Okay. Because once the bone marrow is defective, it means all blood cells will be affected. It will not be able to produce any of the blood cells, whether it's white blood cells, whether it's red blood cells, whether it's platelets. So you're going to find that this human being is going to have a reduced immunity. Okay, so this is the other type of anemia. Signs and symptoms of this type of anemia include pallor. Pallor simply means the patient will be looking pale. You look at the patient's eyes, the eyes will not even have a red tint in them. When you look at our eyes, you're going to notice that a normal human being should have a tint of redness in their eyes. However, a patient who is anemic will be very pale, which means that their eyes will look very white. There will be no redness in them, no blood vessels will be showing. Patients will have lethargy due to cerebral hypoxia. The patient will be prone to minor infections like sore throats, okay, tonsillitis. All right, this is all due to the fact that the bone marrow is unable to produce red blood cells, okay? Sorry, white blood cells. And so the immunity of this human being is reduced. Therefore, they're going to have all these tiny infections, such as sore throat, tonsillitis, pharyngitis, okay? The patient will easily bruise because the thrombocytes or the platelets are also in reduced numbers. So you find that the patient's skin will almost always be bruised, but they just scratch a little and they become bruised, okay? That is the other clinical manifestation. The other clinical manifestation of aplastic anemia. Now let us look at the general manifestations of anemia. General manifestations of anemia include shortness of breath when exertion. That is when the patient just tries to do a slight exercise. They try to go up one flight of stairs. They experience shortness of breath. That anemia will cause that. Okay, headache due to cerebral hypoxia. Hypoxia is simply the lack of oxygen in a particular body tissue. So when we add the word cerebral, we're talking about brain. So we're saying that there will be hypoxia of the brain, cerebral hypoxia. Okay, the patient will experience dizziness due to cerebral hypoxia, faintness due to cerebral hypoxia. The patient will experience tingling, okay, or pins. They will be feeling like someone is, they will be feeling that they have some pin pricks, okay, on their extremities, the fingers, the toes. They'll be experiencing some pinpricks. Patient will have tachycardia. Tachycardia will lead to heart palpitations. This is as a result of the heart's efforts to try and increase blood production. To try and increase circulation of blood. So the heart will be overworking because there is hypoxia in most body tissues. Therefore, the heart will try by all means to pump as much blood as possible to all body parts. Therefore, this patient will have tachycardia, which will lead them to having heart palpitations. Okay. When it becomes very severe, patient will actually end up having cardiomegaly, which is enlargement of the heart. Okay, the patient may end up having edema and pain on the heart, which is angina pectoris. Now, what will you do for you to confirm that this is anemia that the patient has come with? When a patient comes to the unit, we all know that once you get the history, you now have to do investigations that include lab investigations that you need to confirm now. Before you start treatment, you need to confirm that the patient indeed is suffering from this particular disease. And some of those investigations you're going to do include a full blood count, okay, which will show decreased number of circulating erythrocytes, okay. A full blood count will show decreased number of red blood cells, okay. The precursors to red blood cells may also be very, very low, okay. It will also show that even the thrombocytes will be reduced. Even the white blood cells may be reduced, okay? You can do a serum iron and total iron binding capacity, okay? And this is going to be low as well. All these things will be low. You can do a blood film which will show changes, okay, in the cell structure, in the cell, the way the cell looks, okay, the size of the cell, all right. Okay, in some anemias you find that the blood cells will look very pale, and in some anemias you find that the blood cells will look smaller than normal. Okay, hemoglobin levels will also be reduced. You can do a stool for microscopy. You take stool from this human being and you take to the lab. And this is in order for you to find out what is causing this anemia. Okay, so you take this stool to the lab and they're going to test it for presence of blood. And if it is positive, then you suspect there is bleeding somewhere in the GIT. Now, if this blood is fresh, it means they're bleeding from somewhere near the rectum, okay? And if this blood is digested or occult, meaning the stool will look darkish in color, it will look dark, that is known as occult blood. That means the patient is may be bleeding from somewhere upper in the GIT, for example, in the stomach or the duodenum. And so this blood has been partially digested, okay? And then you will find that you can also, when you take this stool to the lab, they can check for eggs for worms, all right? Once they find eggs for worms, it means that obviously the worms have been eating this patient's food or they've been sucking the blood from the GIT. You can do a blood smear to rule out conditions or diseases like malaria, which cause hemolysis of red blood cells. Okay. And then how do you now treat this human being? You have discovered, yes, the patient has anemia. So how do you treat this person? The first thing that you're going to do is, if you have discovered the cause of this anemia, you need to treat it. Okay. However, if the patient's anemia is very, very severe, you need obviously to start with giving blood transfusion. All right. You give blood transfusion in this human being, and then you start giving blood drugs that will help in the production of red blood cells, including folic acid. Folic acid 5 milligrams once a day per oral, okay, for at least a month, depending on the severity of the condition. It could be 2 weeks, it could be 1 week, it could be 1 month, all right? You give oxygen. Remember, the patient is hypoxic, so you want to give oxygen in order to help with the provision of oxygen to all body parts. Okay? You can administer iron, which is ferrous sulfate, 200 milligrams 3 times a day for 1 month. Okay, and obviously, if you have found that the patient has anemia and has malaria, you're going to give drugs that will treat malaria. Okay, if you find that the patient has worms, you're going to give antihelmintics, which are going to kill these worms. So you have to deal with the cause of this anemia. All right. Now, there is this that is known as red blood cell indices. Okay, these are used to determine the type and cause of anemia. Okay, the type and cause of anemia. So, we have mean corpuscular volume. This simply means the size of the red blood cells. The size of the red blood cells. When you do a blood, you take the blood to the sample for full blood count. Full blood count simply means the counting of the blood cells. They will count the white blood cells. All the types of white blood cells will be counted. The red blood cells will be counted. Okay, the platelets will also be counted. Now, when they say mean corpuscular volume, we're talking about the size. Remember, we said that in some types of anemias, we have the sizes of the red blood cells reducing, or in other types, the red blood cells will be um, increasing. When they say mean corpuscular HB eh, or mean corpuscular HGB, that is the amount of hemoglobin in one red blood cell. Okay, so in some anemias, the red blood cells are normal in size. For example, we have normal red blood cells in anemias that cause bleeding. When a patient has been bleeding, it means the red blood cells that will be there will be. And it's in some anemias, you find that the red blood cells will appear smaller than normal. For example, in iron deficiency anemia, you find that the red blood cells will appear smaller than normal. Okay, and then um, in other anemias, you find that the red blood cells will appear larger than they should be. And an example of such is vitamin B12 deficiency. Okay, vitamin B12 deficiency anemia, the red blood cells will appear larger than normal. And this is known as the macrocytic. It means the red blood cells are larger than normal. And then when it comes to the presence of HB, in some anemias, the amount of HB in one blood cell is going to be normal. And the examples in which the blood cells are normal in color include bleeding, okay, hemorrhagic anemia, And the red blood cells will appear normal in color, and that is known as normochromic. And then in some other types of um, anemias, you find that the red blood cells will appear very pale, okay? There won't be a lot of HB in them, and that is known as hypochromic, okay? So those are some of the red blood cell indices, okay? Those are some of the red blood cell indices. So this table is just simply showing you what is a possible cause of these types of indices, okay? So for example, you look at a classification when anemia is said to be normocytic, normochromic, meaning the normal size and the normal coloring. So you're going to say that this anemia is caused by blood loss, okay? Blood loss may cause the patient to have normal, normal cells, normal looking cells, normal size of cells, normal colored cells. Sickle cell disease, where these blood cells are breaking down, the sizes will be normal. Maybe the shape will be distorted, but the sizes will be normal. Uh, uh, the color will be normal, right? And then we have microcytic hypochromic, where the color of the cell looks very pale and the size is very small. You find that the patient you start suspecting iron deficiency, you start suspecting vitamin B12 deficiency when the patient's blood cells have become uh, larger than normal, okay? So here is the nursing management. We will look at nursing management properly and how to write your nursing management properly. But meanwhile, this is the nursing management for um, for anemia. Okay, this is the nursing management for anemia. And so this is the end, brings us to the end of this session.